FM 106.3.
And good morning. Welcome to Community Voice. I am your host, Josh Engel. Today we have a very special guest. We have Dr. Peter Ojuro, board certified in gastroenterology and internal medicine. He is a board-certified gastroenterologist with West Georgia's Gastroenterology Associates and member of the medical staff at Tanner. He will be appearing today on the program to discuss the importance of early colorectal cancer screening, such as a colonoscopy, and Tanner's direct access colonoscopy service. Dr. Ojuro, good morning. How are you, sir?
Good morning. How are you doing today?
Wonderful. Thank you so much for joining me.
Thank you.
If you want to bring that mic a little closer to your face there.
Thank you.
So we've got to make sure everybody hears you. Nobody needs to hear me. They need
Absolutely.
To hear you. So, we have a lot to talk about, so why don't we hop right into it? First and foremost, for folks who might not be aware, perhaps they're too busy trying to spring break down in Miami, and they don't have time to worry about colonoscopies and whatnot. Why don't we tell folks at home what is a colorectal cancer?
Well, just to reiterate what your introduction, my name is Dr. Peter Ojuro, and I'm part of a very prominent only GI practice in Carrollton, Georgia, initially founded by Dr. Howard Seaman, who is retiring, by the way, this week.
Wow.
Yes.
Well, congratulations.
That's right. And so it remains myself. We have Dr. Lucas, Dr. Allage, Dr. Sharma, and we have 3 nurse practitioners in our practice. And our practice encompasses pretty much the whole of west of this part of Georgia, including Bremen, Carrollton, Villa Rica, and we even go all the way to Wedowee, Alabama.
Excellent. So,
yes.
How long have you been with Tanner, the organization?
Myself, I've been here since 2017, and my family came from New York, and now we are settled in this small part of Georgia.
You like Georgia?
I used to like the weather until this winter. When I woke up one day, I thought I was in New York.
You're like, wait a minute, this is what I got away from.
Absolutely.
Sure.
Yes.
Excellent.
Yes.
Well, let's talk about colorectal cancer.
Yes, colorectal cancer is a very, very important topic to me as a gastroenterologist. Certainly, of course, because it's one of the second leading causes of cancer deaths in the United States. Now, colon cancer usually begins, and this is what I tell my patients, is that you may have a small pimple-like growth in the lining of your large bowel. And over time, that small growth can become bigger and bigger and actually invade through the walls of the colon and metastasize through your blood and your lymph nodes to your liver. And at that time, it's too late.
And at that point, it can spread into your brain and lungs.
Well, usually to the liver mostly, and at that time, mostly, it's too late, and the treatment is different and mostly palliative.
So, what causes this?
What causes colon cancer is there's a lot of theories out there. However, we strongly believe that there's a lot of environmental and genetic risk factors associated with colorectal cancer. For example, I usually tell my patients that studies have shown that patients that eat a lot of red meat or highly fatty foods, people that are diabetic or have something called metabolic syndrome, which includes diabetes, hypertension, being a little heavy in the middle, are at a higher risk for getting colorectal cancer. Then, of course, it's the genetic aspect of it, which is usually with family history or certain medical conditions that tend to run in the family. Usually when I see patients in initial consult for a colonoscopy, I typically ask them, do you have any other family members with not only colon cancer, but ovarian cancer, uterine cancer, breast cancer, if they have any family members with Crohn's disease, ulcerative colitis, and things of that nature.
So those are all sort of in the same family, or at least similar.
Yes. Well, those are things to consider because they may put a person at a higher risk for getting colorectal cancer.
So you said that this is the second leading cause of cancer death, correct?
Right.
This is pretty common.
Well, it's pretty common, and I have some facts in front of me that it affects men and women usually equally. Okay, 60% of colorectal deaths actually could be prevented with a simple screening procedure, like a colonoscopy or stool studies that we usually get with our primary care doctors. And if you look at some numbers, this year, the American Cancer Society predicts that there will be almost 150,000 cases of colorectal cancer found just this year.
Wow.
Okay? And almost 53,000 Americans will die from colorectal cancer, and that should not be happening.
No, and as we'll be talking about at length here later, Tanner's going out of their way to try to make it easy and accessible for folks to get their colonoscopies so as to prevent those unnecessary deaths.
Absolutely.
So what are some risk factors for colorectal cancer? You mentioned earlier genetic predispositions and diet. Are there so many other risk factors folks should consider?
Yes. Well, let me ask you, how old are you right now?
I am 33.
33.
Yeah.
Yes. Well, myself, I'm getting closer to the magical year. And
the big 5-0?
Typically, that is the big 5-0. Okay. And the other day, I saw a patient in my office, and he said, I asked him, so you're 49 years and almost 50, but why are you here? He looked at me and said, well, this is a gift from my wife to get a colonoscopy.
Sure.
And I said, that's a good wife.
Yes, that is a great wife.
Because she really cares about his health. But certainly, with the age 50, those recommendations are kind of changing right now. Let's look at certain specific populations. For example, African Americans actually recommended to have their colonoscopies done a little earlier. We're talking about 40 to 45. And current recommendations are actually going to reverse back from 50 to between 40 and 45 as the initial time for you to get your first screening colonoscopy or screening procedure.
Wow. So you just moved that clock up about 10 years
Absolutely.
for me. So yeah, I better get ready.
Well, not yet. But I'll tell you a specific story that from my own experience. I had a young gentleman came to me, and he didn't have any problems whatsoever except just some change in bowel habits. And he had a family history, but he did not know about it. And he was only 30. He was only 33 years old.
Oh my
when I
goodness.
diagnosed his colon cancer.
My age.
Yes, absolutely. And it was quite advanced. In his case, that he required surgery and element of chemoradiation after the surgery. So I always tell my patients, look, it's not only after 50 years old, it can happen earlier. And that's why you have to really pay close attention to your body and know your family history in and out.
So, you mentioned paying attention to these various risk factors, to be aware of them. What if a person has no risk factors?
If they have no risk factors, then they're going to have to really, really pay attention to their body. For example, if you have change in bowel habits. And when I say change in bowel habits, I mean something that is prolonged for more than 6 months. In other words, you were going every day like clockwork, and all of a sudden one time, things just change and it just prolongs. If the stool is a little thinner, if there's any blood in it, if there's mucus in it. So it's very, very, very important to pay attention to some of this.
Sure. What is it? The Bristol scale or the distal scale? Can't
That's
remember.
right. We always have a little scale in front of on our examining rooms.
Sure.
But nonetheless, some of those things, and having sustained weight loss that you can't have an explanation for, or abdominal pain that usually attacks at night, and you can't explain why that is happening. So some of those things are things that we really, really pay close attention to as a gastroenterologist, as far as maybe stratifying a patient that may be at risk for colorectal cancer.
If you're tuning in on the radio here, be sure to, if it's available to you, check out the Facebook live stream that we have going on right now with Dr. Peter Ojuro, board certified in gastroenterology and internal medicine. If you have any comments or questions for the good doctor, feel free to hop on our Facebook live stream and throw those in there, and I will be happy to ask them. So we're going to take our first break, but when we come back, we'll continue our conversation with Dr. Ojuro as we talk about the importance of screening for colorectal cancer and their Tanner's brand new, relatively new, direct colonoscopy hotline. So stay with us.
Travel, get-togethers, Sunday morning worship. COVID-19 has almost put a stop to our way of life. Vaccination is our best shot at getting back to normal. The COVID-19 vaccine is based on more than a decade of research. Trials show it's safe and can provide up to 95% protection when you've received both doses. Tanner is committed to making the vaccine as widely available as possible, giving you a shot at getting back to life. Until then, keep wearing your mask, washing your hands, and avoid gatherings. Learn more and get updates at tanner.org/vaccine.
At Oak Mountain Academy, we are a family creating legacies. The Fortner family shares. OMA has assisted us in providing our 3 children with a solid educational foundation and a love of learning. The Academy has done so with an emphasis on building a strong inner character. We would love to share more with you about our school community and how you can become a part of this legacy. I'm Patrick Urian, headmaster, inviting you to join us for our virtual admissions open house on Thursday, April 1st at 9 a.m. Register today at oakmountain.us.
And we're back to Community Voice. I'm your host, Josh Engel. Today we got Dr. Peter Ojuro with Tanner, who's a board-certified gastroenterologist, and he's certified in gastroenterology and internal medicine. We're here to talk about the direct colonoscopy hotline and, of course, the importance of screening for colorectal cancer. That clock is ticking for all of us. Well, you got to be ready to go get your have your colonoscopy. And as we're learning here, and if you're just tuning in, be sure to go check out the live stream that's happening on Facebook so you can catch the beginning. And you can hear some very important information about signs and symptoms and different risk factors. So definitely go check that out. But we'll continue our conversation here with Dr. Ojuro. So now that we have sort of an idea of some factors to look for, signs and symptoms, so what kind of screenings? Let's say that you start having some of these symptoms. So
Right.
you got a sudden weight loss, constant fatigue, change in bowel habits, blood, mucus in your stool. So what's the next step? What are screenings that you can do?
Well, typically, most patients have a primary care physician. Or in most cases, if you have a primary care physician, it's usually your wife.
Yeah.
So tell your wife that I'm having this. They say, well, you need to go see a GI doctor. But nonetheless, there are, when you come to see us, we kind of stratify what tests would be appropriate for that particular patient. And really, a colonoscopy is a gold standard for evaluating for colorectal cancer, especially if patient comes in with all the symptoms of weight loss, change bowel habits, blood in the stool, abdominal pain that they can't explain. We usually make arrangements for them to have a colonoscopy. And the good thing about a colonoscopy is that you get a complete evaluation of the entire large bowel. In some cases, if we suspect Crohn's disease, we are able to get into the last part of the small bowel called the terminal ileum, which we are able to examine as well. And usually when you do that examination, we are able to do biopsies if we need to. If we find polyps, we're able to remove them because polyps are the beginning or the beginning lesion that can lead to colon cancer. So if you remove them, your risk of getting colon cancer is greatly reduced.
It would reduce the chance of it working its way through the lining, metastasizing, and spreading.
Absolutely. And then, of course, in some cases, we may do a colonoscopy screening and we find cancer. Wow. And in that case, we do biopsies. And then from there, we're able to work that patient up to our Tanner cancer, a 3-day cancer program, which means that the patient is seen immediately by one of the oncologists, either Dr. Q, Dr. Pierce, or Dr. Larson. And then they are worked into the system whereby they get the full support in terms of imaging, tests, labs, and eventually seeing a surgeon if they need to.
We're very lucky, aren't we?
I would suppose so, because in this small town, we have all the specialists, and I tell most of my patients, you don't have to get on the I-85 or the I-20 to go to Atlanta because we can take care of you right here.
Oh, that's such a gift. I'm so thankful for that.
Absolutely.
Because the last thing you want to do is hop on the interstate, deal with that when you're about to go have a colonoscopy. So
Absolutely.
I got to get this out because I feel like, no one's asking this on Facebook yet, but I feel like, of course, someone's thinking it.
That's right.
So what's the prep like for these colonoscopies? Because I've heard, some of them are very intensive, and you have days of stuff. I don't know. Can I eat for a month leading up to it? What do I got to do?
No, you don't. You don't have to hibernate like a bear. But nonetheless, when I tell my patients that when you're having this procedure done, you need to have a whole support network. And that support network come from your physician, from our office staff, who are very, very instrumental in discussing with the patients even the day before if they have last-minute questions. But nonetheless, the basic fact is that you need to have a clean colon for us to be able to have a good exam. And following those instructions is very, very, very important. So what I tell my patients is, for example, if they're taking iron, if they're on blood thinners, that we should discuss that immediately with their primary care physician. If they're taking iron, I tell them to stop that for about a week. Certain medications we want to eliminate, even herbal medication we want to eliminate a week or so before the colonoscopy. The day before the procedure, we give them a solution that sort of flushes out their colon by having multiple loose stools. And we tell them that they cannot eat anything solid the day before the procedure. And some patients I tell them, hey, look, you're going to lose 5 to 10 pounds after this procedure. And they say, yes, let's go ahead and do it.
This is great.
This is great.
Can I sign up today? I'll sign up with you.
Absolutely.
Make an appointment.
Yes. And then the day of the procedure, it's very, very important for them to follow the instructions, come in early on time. I let them know that, look, you're going to get an IV. Through that, we give you the wonderful medications for you to fall asleep for the procedure. You have nurses in the room. Patients are comfortable. It doesn't take long at all to do a colonoscopy. It takes about 15, 20 minutes in most capable, good hands. And during that time, the patient is comfortable. After that, they wake up, and I'll tell them exactly what I found. And then usually they're ready to go home with their family, and then they're able to eat. And most people are actually able to go back to work the next day without a problem.
So they're fine then.
Absolutely.
It's not super invasive. Prep is not crazy,
and then there's many different kinds of preps, and we're actually coming out with newer preps where you don't have to drink a lot of volume. But usually it's all patient dependent. If you follow the instructions, everything always comes out perfect.
So I got to ask this also because I'm not going to name any names, but a lot of folks that I know who are a bit older than me that have had their colonoscopies,
yes,
so many of them have referred to how great the medicine is that you guys don't feel anything. What medicine do you use?
Yes, well, we use propofol, as is known on the street, the Michael Jackson drug.
Oh,
yes,
that's it. Okay,
and it's actually administered by a board-certified anesthesiologist or a CRNA, and the patients are comfortable. Their blood pressure, their heart rate, their breathing, everything is being monitored during the procedure, and every time we do these procedures, we have very, very good outcomes because the patients are very comfortable.
When you're in very good hands, you can be safe, comfortable,
Absolutely.
Relaxed. So these are very effective. No colonoscopies. I mean, that's the most effective possible.
Yes,
screening.
like I mentioned, is a gold standard, and however, there are other ways to check for colon cancer. For example, you've seen the commercial with the little Cologuard cartoon. And as a gastroenterologist, of course, I always say, well, we need to do a colonoscopy. However, there is room and need for all those other tests. The reason why, because not everybody wants to have a colonoscopy or is ready for a colonoscopy. So all those other tests kind of help their primary care physicians to determine who needs to be sent to have a colonoscopy. For example, if your Cologuard comes back positive, then certainly you need to have a colonoscopy for further evaluation of what's going on. And there are patients who are scared of a colonoscopy, patients who cannot afford a colonoscopy, and those other alternatives are very, very important in terms of screening for colorectal cancer.
And that Cologuard, that's one of the at-home screening tests.
At-home screening test. There's a FIT test, and the Cologuard is a DNA-based newer test that most primary care physicians are recommending for their patients.
I see. Well, we're going to take our next break. But when we come back, we're going to continue our conversation with Dr. Peter Ojuro, board-certified gastroenterologist with Tanner and West Georgia Gastroenterology. We're talking about the importance of screening for colorectal cancer and their direct colonoscopy hotline. So stay with us.
Travel, get-togethers, Sunday morning worship. COVID-19 has almost put a stop to our way of life. Vaccination is our best shot at getting back to normal. The COVID-19 vaccine is based on more than a decade of research. Trials show it's safe and can provide up to 95% protection when you've received both doses. Tanner is committed to making the vaccine as widely available as possible, giving you a shot at getting back to life. Until then, keep wearing your mask, washing your hands, and avoid gatherings. Learn more and get updates at tanner.org/vaccine.
At Oak Mountain Academy, our academic excellence shines through innovation and a personalized educational experience. From pre-K 3 through 12th grade, our school encompasses a family-oriented atmosphere. Our faith-based value system works as a foundation for supporting our honor code, while our academic standards prepare our students for college and beyond. I'm Patrick Uran, headmaster, inviting you to join us for our virtual admissions open house on Thursday, April 1st at 9 a.m. Register today at oakmountain.us.
And we're back to Community Voice. I am your host, Josh Engel. We're chatting with Dr. Peter Ojuro, board-certified gastroenterologist with West Georgia Gastroenterology and Tanner Healthcare. We're talking about the importance of screening for colorectal cancer and their direct access colonoscopy hotline. Here's the thing. It's a very important topic. As we were discussing earlier, there's a lot of people that pass away unnecessarily each year from colorectal cancer. So if you're just tuning in, be sure to check out the Facebook live stream, which will be on the WLBB Facebook page, or you can go check out the podcast, which will be uploaded to this station's website as well as gradacommunications.com. So Dr. Ojuro, let's say worst case scenario, you do your colonoscopy, you have the test, you get back the results. You have colorectal cancer. How does Tanner treat colorectal cancer?
Well, what I always believe in as a physician is that we are very, very instrumental in terms of passing some of this news to the patient, because it's a very, very difficult time for anybody to get a diagnosis of colorectal cancer. So our compassion in terms of treating these patients is very, very important. From myself to my office staff, and usually if I have a positive pathology indicating that one of my patients has colorectal cancer, I make it a point to call them myself. Or most of the cases, have them come to the office with their family so that we can be able to give them this news and be able to answer all their questions. Like I mentioned earlier, Tanner is very, very well equipped in taking care of these patients. We have a 3-day cancer program with very, very competent board certified oncologists with a support staff. We have our imaging studies at the hospital, because most of these patients usually need to get either a CT scan or other imaging studies to make sure that this cancer did not travel to their liver and other organs. Also our lab work, because we have to measure something called the CEA levels prior to treatment and things of that nature. So the treatment process is usually we refer them to the oncologist, depending on the stage and how early or how late the diagnosis is. Then that treatment protocol is usually defined by the oncologist. Certainly, it's very, very important for us to keep close contact with these patients, because if they have cancer, usually they need to come back to us within a year for further surveillance colonoscopies if the treatment was successful. And just to mention, in most cases, even if we find a polyp, we usually tell the patients to come back within 5 years for their next colonoscopy. If we don't find any polyps, then we should tell them to come back in 10 years for their regular screening process.
So if you find a polyp,
yes,
then you're going to need to come back in at least 5 years.
Yes, if it's a precancerous polyp, chances are that you're going to need to come back at least within a year. If they're a certain number, if they're bigger, then it could be a year, it could be 3 years, but usually we make that determination with the patient depending on what we find.
So how quickly can it turn? So let's say, if you have a precancerous polyp.
Right.
Is that, is there an estimate as to how quickly that can become cancerous?
Well, they had studies to show that if you have a polyp that is precancerous, usually within 5 to 10 years to 15 years, it can become cancerous, depending on other environmental and genetic risk factors. But that's the reason why we do a colonoscopy, so that we can remove those lesions before they become cancer.
Wow. So that's something that you can get on quickly, and you can, try to take steps to try to.
Absolutely, yes.
Well, that's actually a great next question. So, what are some steps that people can do to try and prevent ahead of time, preventative measures? Like, for example, you mentioned red meat.
Yes.
Could you potentially, just based on the current papers that have been published, the scientific journals and whatnot, should you avoid, red meat?
Well, this is what I tell my patients. Being overly healthy is very, very important. And we're talking about healthy as far as exercise, what you eat, what comes in through your mouth. I'm not telling them they cannot eat red meat. However, less red meat. I'm not telling them they can't drink soda, but less red soda. In other words, I'm not telling you to move into a monastery and become a Buddhist, but, everything into moderation. High fiber diet, exercise, mental health is very, very important. And of course, we've just gone through we're still in the pandemic. A lot of patients have put off all the screening programs as far as breast cancer, lung cancer, colorectal cancer, and we are trying to convince them that we have a nice, safe environment for them to continue with their recommended screening protocols. So screening is very, very important in terms of preventing colorectal cancer.
So we only have about 4 minutes left. I would love to wrap up chatting about this direct colonoscopy hotline that Tanner has provided to the West Georgia area.
Absolutely. So I'll talk a little about the direct access colonoscopy. As one of the gastroenterologists, we do have our endoscopy center where most of our healthy patients come in to get their procedures. But certainly, if a patient is, let's say, turning 50 years old and they have no other major medical conditions like COPD, diabetes, arrhythmias like atrial fibrillation, heart disease, CHF, and they're not morbidly obese. We're talking about BMI greater than 40. But certainly, some of those patients, they can be able to be scheduled for their procedure by just calling a number and going to our website and getting the basic information and getting scheduled for their procedure without having to go through their primary care doctor or coming to see us in the office.
So you can go just directly to your guys' office to start working that out.
Absolutely. Yes. And certainly that information is in the Tanner website. And we do have a phone number that they can call, and I read it out here, 770-812-9097, that they can call to initiate that process.
Wonderful. Yes. So they can start the ball rolling without having to go through their primary care physician. They can schedule their appointment, and then relatively quickly, since Tanner has so many resources available, they can get in to have their colonoscopy.
Absolutely. And the good thing about Tanner is that all our with the electronic medical records, all our physicians are in communication one way or the other. In other words, if you're going to get a colonoscopy, after I do the procedure, most of the time your primary care physician will have access to that information and what we found and what the recommendations are.
As long as they are in the Tanner system.
Absolutely.
Which is a great way to be able to
communicate.
Yeah,
yes,
great way
exactly.
to communicate.
Yes.
Perfect. Well, so we are... that really answers my questions. I really appreciate you coming on today. Are there any, where can folks find more information about your office or about just Tanner in general?
Well, like I said, our office, we're in Bremen, we're in Villa Rica, we're in Wedowee, and we're in Carrollton. And, most of the patients that come in through the hospital system, we usually will have contact with us if they have any GI complaints or GI issues and things of that nature. And certainly we are quite involved in the community. Like I mentioned, Dr. Seaman, who is our founder, is retiring sometime this week. And we're very, very proud of him. And myself, I wouldn't be here if it was not for him, convincing me that this was a great opportunity, this is a great community to live in and to practice.
Well, we're very appreciative to Dr. Seaman and his years of service.
That's right.
And I appreciate you, Dr. Ojuro, for joining us today. Thank you very much for tuning in. We'll see you next time.
Thank you very much.